It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I had this big hole in my mouth.
I knew it was time to do something permanent.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
Mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We're talking about the mini dental implant procedure. It's going to change your life, and we're welcoming Dr. Bruce Fine from Fine Dental Care, a mini dental implant center of America located in Wayne, New Jersey. You can be you again with a same-day smile. The mini dental implant is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. FDA-approved product made in America. You don't want to hear me talk about it. You want to hear Dr. Bruce Fine talk about it. Doc, show us the difference between a conventional and a mini using that mandible example.
Well, here's the mandible. And the first aspect I'd like to show you is, you see how it's ground down? With a conventional implant, when we replace the whole jaw, we have to grind the bone down. With the mini dental implant, we don't have to. Here's another example of it. Look at the size of the holes. The size of the implant hole is much, much larger, while the size of the mini dental implant is much, much smaller and much more shallow, because the mini dental implant is put in almost like a wood screw. We don't drill the hole to the full depth of the implant. The implant is actually screwed in and it engages the bone, while with the conventional implant, the hole has to be the same width, the same size, and you have to wait 3 months for the implant and the bone to join together.
And the difference in the size of the hole alone, the conventional implant takes months of bone grafting, months of healing time, which means more time at the dentist, more cost. But the mini is just that. It's less time, less expensive, and less invasive. And that titanium post is what holds the tooth. We'll see that a little bit in place.
Yes, it does. It's just very dramatic, and how much better it is, how much less expensive it is. It's dramatically less expensive. And as far as discomfort goes, very, very little, because it's like ear punching. It's then a small drill hole that's created, and it's just dramatic and how much better it is.
So Doc, let's talk about how the mini dental implant procedure works for denture patients. You know, the lower denture, for example, it's swimming around on the bottom of the gums. It has a life of its own. The mini dental implant is going to make this a secure option without embarrassment, and you can enjoy your food again. Show us what the lower denture is like with the mini.
Oh, it's very dramatic. Most dentures, as you said, they float around, they fall out. People don't wear their lower dentures because they move so much. Look at this. This does not move. It holds in place. The reason is because the mini dental implants actually snaps out and snaps in.
Now listen to that. It's so secure.
Oh, it is. Look. And it's dramatic. People can eat almost everything that they love, that they haven't been able to eat. That's how great these are.
And I know that some people with lower dentures, my mom suffered from this, you know, he had the paste, the glue, the goop. Then now that goop is gone.
There's no need for the goop, otherwise known as paste, because this locks it in place, snaps in. And instead of having to take it out at night, you only have to take it out once or twice a day, and wear it while you're sleeping. Wear it during the day, because you're gonna love it. It's just like having great, wonderful teeth again.
Now, odds are if you have a lower denture, you probably have an upper denture. And we talked about all the great foods that we love here in the great state of New Jersey earlier. You know, folks, if you're going to bite into that great steak, Doc likes his medium rare, right?
Oh, love medium rare,
yep.
Yes.
You love that Japanese food and cheesecake from all the diners.
Yes.
Sushi, and biting into an ear of corn and chewing an apple. Now the sense of taste is going to come back with the mini dental implant with an upper denture. Show us why, Doc.
So if you see here, it doesn't cover the roof of your mouth. Watch. It snaps out, and it doesn't cover the roof of your mouth. The roof of your mouth has many taste buds.
And that's because that plastic that is usually in place where that U is in there.
It's usually straight across here. The conventional upper denture But this one, we can take it all out here because it has housings that allow it to snap in. Watch.
Wow, and flip that around like an upper, and look at that. That's so beautiful. And that plastic, the full plastic in a conventional denture is there to keep the suction, and which
That's
impacts
right.
your speech as well, right?
Yes, and because this has much less in the way of plastic and acrylic, it's much better for talking. It's less chance of being gaggy with conventional dentures are. This is just amazing. It's just amazing how much people love this, how much it changes their life in such a positive way. It's just amazing in what it does.
So there's an example of the upper and the lower dentures, but now we're going to talk about what's called the fixed on 6. This is like a full set of teeth, isn't it, Doc?
It's just like having your own teeth back again. It's 6 mini dental implants and a set of teeth that stay in place, that you do not remove or you can't remove, and we only take it out when you come in for cleanings. So it's just like having natural teeth again. Isn't that beautiful how it looks?
Looks great, and it could be an upper or a lower or both.
That's correct.
And what
That's correct.
what are those teeth made of?
They're made of a very strong material, almost as strong as our own teeth. So it's very dramatic in how you can basically eat everything.
And I know that if God gave us our baby teeth and our adult teeth, Dr. Bruce Fine from Fine Dental Care and Mini Dental Implant Center of America is going to give us a permanent set with this example, which is called a roundhouse.
That's correct.
Yeah, so the roundhouse example, this is a permanent solution.
This one is cemented in place. Looks great, doesn't it? But it's made out of even stronger material. It's called zirconia. And this material is a material that's similar to diamonds, the zirconia, but it's rock solid. It's a beautiful set of teeth. And it's just like, again, like having your own set of teeth in there, and it works great, lasts forever, and it's just fantastic.
Show us how many implants are in place when you do the roundhouse example.
Because this is so much heavier and stronger material, it requires more implants.
Ah, and that's cemented in permanent, never to come out.
That is correct.
So when we go to see you at Fine Dental Care, you'll have all of the cleaning and you'll have all of the care, and you come in from time to check on it, but it's never coming out.
That's correct. And it's critical that you do come in for regular cleanings and do your brushing and flossing at home so that you never ever have any problems, because our goal here is for this to last you a lifetime.
Yeah. So now, Doc, if you have teeth that are in the back of your mouth,
Yes.
and I know that sometimes it's human nature, it's out of sight, out of mind, and you think, I'm not going to worry about it. But those back teeth are very critical to the chewing process. And we'll talk about another option too with a single tooth, but show us how those molars are impacted.
Well, it's very important about eating with your molars, because our molars are the critical items in our mouth for us to be able to chew on things. As an example, a number of patients and people who don't have molars, they unfortunately destroy their other teeth because their other teeth really aren't designed to be as strong and to be able to eat hard and chewy materials, and they break down over time. But with the molars, they are replaced with 2 mini implants. So here's an example of one here. That's for what we call a bicuspid. Also one for a bicuspid, and 2 for the molar, because the molar needs strength so that you can chew and eat everything and not damage the rest of your mouth.
Get all those nutrients out of the food. And I'm to understand too that if those teeth are neglected and they're not there, your mouth itself, the shape of your face will start to deform a little bit.
That's correct. A lot of people, it starts to get and fall inward rather than staying as handsome and as beautiful as you are.
And
yes.
you are a handsome guy, Dr. Bruce. Now,
So are you.
thank you. So, and this could
We're both.
replace a partial, couldn't it?
Oh, absolutely. But the critical thing is you get it done when you lose these teeth, because if you wait over time, it's very possible that you won't have adequate bone to replace the implants. And the huge advantage of these mini dental implants is even if you lost a lot of bone, the mini implants still can function and be placed, while conventional implants, because they're so large, can't be, and require these major surgeries and things like that to be able to have enough bone for the implants.
Yeah, that titanium post, the bone grows around it. called osseointegration. I've learned a lot here doing Innovations in Health. Now, if you have the back teeth and the molars, we're going to get that fixed. But say there's a single tooth that comes out. You know, there's nothing more embarrassing than a tooth is missing or it gets knocked out or there's a sports injury. Show us how the mini dental implant will have a custom fit, custom made tooth for the patient.
Well, can you see which one it is?
I can't.
It's this one right here.
Wow.
So the same day that this unfortunate thing would happen, we can place the implant and put a tooth on there for you the same day. Isn't that amazing?
It seems unbelievable, but it's not. And the flippers are gone, all of those conventional things from all those years ago.
Right, all those removable things can be a thing of the past.
Same day smile with Dr. Bruce Fine at Fine Dental Care, Mini Dental Implant Center of America. Now here's the address. It's been on the screen, but we want to read it to you so you write it down. 600 Valley Road, and they're in Wayne, New Jersey. The website, by the way, if you want to find out more, is minidentalimplantswaynenj.com. And there's a phone number to call, 973-636-1113. And I know, Doc, the Fine Dental Care office is in the Whole Foods Center.
That is correct.
Yeah, so we all know where that is. You got Route 80, 23, 46, Route 3, 202, 208. It's like a bingo game, but you're close to all of these locations.
And in fact, we're right across from Wayne Valley High School. We're down the street from the Wayne Municipal Building, so we're right in the center of town.
So if you know Wayne,
you know where I am.
You're going to be able to find Fine Dental Care. So let's get to know you a little bit. We've talked about the mini dental implants, but we'll get back to that. But where are you from?
From Wayne, New Jersey.
Wayne, New Jersey guy.
Yeah, I grew up there.
Yeah. Where did you go to school?
I went to Lafayette School in Wayne, Anthony Wayne Junior High School, and Wayne Valley High School.
And where did you get your dental degree from?
I got it from Georgetown University School of Dentistry, where I even taught when I got after I graduated.
Yeah. How long have you been in practice? Because you came back here to Wayne after all of your schooling.
Yeah, I've been in practice now for 35 years.
You started in, what, I guess, 1987 or so.
No, 1984, but the practice in Wayne has been since 1987.
Gotcha.
Yeah.
Great people here in Wayne, New Jersey, aren't there?
Oh, fantastic. I love the town. I've lived there for now 60 years.
Yeah. And what's nice about Dr. Fine, everybody, is he's been voted by 201 Magazine, we all read 201 Magazine, he's been voted one of the best dentists in New Jersey, the whole Garden State. And not just from 201 Magazine, but other publications as well, as one of America's best dentists. How does that make you feel?
It's just amazing that that occurred. I wasn't pushing for it or anything like that. It just keeps coming at me, and it's just a wonderful, wonderful thing.
Well,
I'm so surprised about.
You care about your patients, and I think that's what's most important.
Oh, absolutely. That's my first concentration on what I do, is focusing on taking care of people.
We'll read some more of your credentials, and by the way, they're online at minidentalimplantswaynenj.com. But you're a member of American Dental Association, a fellow of the Academy of General Dentistry, International Congress of Oral Implantologists.
Yes, fellowship there too.
Institute for Advanced Laser Dentistry.
Fellowship, yep.
And a who's who in the continental U.S.
Isn't that amazing?
Yeah, there you go. And you've helped so many people, not just here in the metropolitan area. You know, we talked about all of the areas here in New Jersey that you help, but you've welcomed patients from all across the globe.
Yes, we have patients coming from all over. We've had patients coming from South Africa, excuse me, from Ireland, England, from China, from Israel. It's just amazing. These people come to see me from all these incredible places around the world.
And I know you're a family guy, and your wife is involved in the practice too. Tell us about Linda.
Oh, Linda is so fantastic. She is my office manager. She's a beautiful lady, and the patients love her even more than they love me. I've had patients say to me, oh, I need to be out by so-and-so time. So we get them out by that time, and then I turn around a half hour later, and they're up front talking to Linda and having a good time. So she's amazing.
You make that experience comfortable. And we talked about your family, but I know there's something very near and dear to your heart, and that is your dog, Marley.
Yes.
Tell us about Marley and what kind of breed it is.
Well, Marley is a Puli, P-U-L-I. It's a Hungarian breed that, believe it or not, is over 1,000 years old, but is so rare because during World War II, the whole breed was almost destroyed.
Wow. And I know Marley is a fixture sometimes at the office even a little bit.
Oh, she is. People love to see her.
And I see there's a photo you showed me of you dressed up. Was this for a Halloween event?
Well, we had a event where we did have kind of a Halloween event with kids coming in and had the whole office decorated, and there was Marley. And I was dressed up as Buzz Lightyear.
I was going to ask who you were, Buzz Lightyear. Okay, we all remember Buzz Lightyear.
Yeah.
So let's see if you remember this. I'm going to throw out a couple of names of some songs, all right?
Okay.
As we take your temperature on what you like.
Okay.
Toes, Highway 20 Ride. Who?
Zac Brown Band.
Zac Brown Band, so one of your favorite bands, right?
Yep, and Little Big Town I love also. So
Yeah.
I love country music, yes.
So-
and music also from the 70s and 80s. So
when we come
Yeah.
into the practice at 600 Valley Road, some of that music may be playing there.
absolutely,
Yeah, you
yes.
make it a comfortable experience.
If you want it. If you don't want it, we can.
I know you work
yeah,
with a dentist. I know you go up to Buffalo working with another dentist who helped sort of refine this mini dental implant procedure. Tell us about your connection with a doctor named Todd Shatkin.
Well, Todd, even though I've been involved with implants for many years, it was mostly conventional, but Todd has taken mini dental implants to such a higher level and made them so dramatically better than conventional dental implants. He and I became friends back in the 90s, so it's just amazing what he's done.
Yeah, so when you work together, you bring all that technology right back here to New Jersey.
Absolutely.
And by the way, everybody, I know you're out there watching, and here's the phone number, 973-636-1113. And I know you're watching, and if you're out in Patterson, Montclair, Ridgewood, Glen Rock, in the metropolitan area, even in New York City, you need to give Dr. Bruce Fine a call at Fine Dental Care, a mini dental implant center of America. And I know with your wife, Linda, and your team, and some of your team is from Wayne as well, so you've got a whole
Yes.
group of people there.
Yeah, our associate doctor also grew up in Wayne, went to the same schools I did. He's just fantastic. He only lives 2 blocks away from the office.
So it's a family affair, but you make it
Yes.
affordable because let's face it, you pay for your car on time, you
absolutely.
pay a mortgage on your home. There's some cost involved, but you're going to work with the patient to make this affordable. How do you do that, Doc?
Well, the first amazing thing about mini dental implants is they are dramatically less expensive than conventional implants. So in many cases, it's half the price, half the expense of a traditional conventional implant. It's just amazing.
And I've had dental work done, and I've paid for it on time. And I will tell you, folks, if you're out there and you're thinking about it and you're on the fence, you need to make the call. Take it from me, your life changes. You feel so much better. You smile more, don't you, Dr. Fine?
Oh yeah, and we have this amazing financing that can spread it out over a long period of time, and you only have to pay just a couple $100 a month.
Yeah, just like you would on
Yeah.
on some other things.
Yeah.
And I know that you offer a free consultation, but you've even added to that experience as well.
Yeah, it's not just only a free consultation. We also do a free 3D X-ray of your mouth so that we can figure everything out during the consultation. And again, it's no charge.
And that's called, from what I understand, the cone beam. The technology is like three-dimensional. You're like looking, it's
Yeah.
almost like a science fiction movie.
Very cool. And it's helped me save lives of others in my patients. Yes.
The most advanced. And I know sometimes people fear going to the dentist. They fear, well, pain or some experience they had 100 years ago. But you offer sedation dentistry as well, if needed.
Absolutely. We want you to feel comfortable in the office. That's also one of our goals, is that this is a good experience for you. So we have laughing gas. We even have, you can take some pills that we can prescribe for you so that you're just totally relaxed when we do this.
Some people have taken a long time to go back to the dentist. I was one of them, I must admit. But all those myths should be dispelled, shouldn't they?
Yes, things have dramatically changed in dentistry since we were kids. So.
Yeah, that's true. And we can't accept those soft foods anymore. If you're out there and you have a denture and you're maybe a little advanced in age, that's okay. You want to live the rest of your life enjoying the foods that we love in New Jersey and the New York metropolitan area as well. It doesn't matter the age, does it, Doc?
It doesn't. And it can be food from around the world. It doesn't only have to be Wayne, New Jersey food.
That's true. That's true.
So, we've treated patients with implants from the teenage years all the way up into the 90s. And it's just dramatic that's the beauty of this, how much it changes their lives in such a positive way.
Yeah.
It's just so dramatic in what it does.
And speaking of dramatic, on your website, you have a very interesting way to show a before and after for some of the dentistry that you've done. So if you go to minidentalimplantswaynenj.com, you'll see how that looks. And also you can find out about other dental services, because you do offer Invisalign and some cosmetic
Yes.
work and restorative dentistry as well.
And in those before and afters, it's always the after pictures with just a little bit of the before. So if you don't want to see the befores, you don't have to see the befores. But if you do, you just slide it over so you can see the befores. It's just dramatic. And those are all patients of mine that we've just done these fantastic improvements in their lives.
Yeah, you've made a difference in their lives. Tell us about some of those patients, because I remember talking to your wife a little bit about one of them where a teacher, as a matter of fact, who really had a life-changing moment with you.
Oh yeah, he had a dramatic moment where one of his students said something very uncomfortable for him about how his denture, how he had dentures in his mouth and how they fell out of his mouth. And he was very uncomfortable and wanted a solution to get rid of those dentures. And we did it for him. And he was so happy, and so it just changed his life in such a positive way.
And you made one of his dreams come true, which was to eat and enjoy and bite into a steak.
Yes. Yeah, he was only eating very soft foods, and he was complaining how except when he was out of school and not teaching, he really wasn't wearing his lower denture at all because it was just too floppy in his mouth.
And I know you have some other patients that come to see you, maybe from some other practices, medical and otherwise.
Oh yeah, we have other dentists coming to our office who don't work with us. They're friends, of course, now. We have assistants, dental hygienists who work in other practices who come to see me. It's just incredible. Plus physicians. It's just amazing.
Well, they're not going to come to you unless they know that you are good at what you do. No, you're not good. You're fine at what you do. Dr. Bruce Fine.
Yes.
Fine Dental Care, Mini Dental Implant Center of America. Now, you've heard us talk about the patient experience. Why don't we hear from the patients themselves, all right?
Oh, yes, absolutely.
I just want to say Dr. Fine is the best dentist.
The best top of the line places that I've ever been. And honestly, it's a wonderful place to be at.
I was just singing your praises of how amazing you, Dr. Fine, and Linda has been for our family from day one.
This is my first experience with Dr. Brady and Dr. Bruce Fine's office. Very satisfied and very happy. It was a very pleasant experience this morning.
Didn't need any medication, didn't need any Advil or Tylenol. He is the best dentist. It's the first time in my life I ever had a good experience.
Absolutely no discomfort, no pain at all. Healing is wonderful. I can't say enough how great it was. Good. Thank you.
Good seeing you, buddy.
You too. Thank you.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It's just amazing what it does for your self-confidence.
I am very happy I had the procedure done. I feel as though I have my smile back.
It kind of gave me my life back.
It was totally painless.
What pain? I had no pain.
It's actually really painless, and I wish I would have got it done a long time ago.
It's going to sound corny, but I mean, it is a life-changing event.
And I know you share on Facebook and Instagram some of these patient experiences. There's photos, you're celebrating the patient. But that pain-free piece is very important, because if somebody has a little discomfort, it's just an over-the-counter medication to make it better.
Oh yes, and it's amazing. This is not only for dentistry, but for your lives. If you ever have headaches, body aches, or whatever, there was a study over a decade ago that shows taking 3 Advil and 1 Tylenol is more powerful for most people than opioids for pain relief. But it also is pain prevention.
Dr. Bruce Fine from Fine Dental Care. Let's talk about care. How would you suggest people take care of their mini dental implants when they're at home?
It's not much different than taking care of your teeth. Cavities and gum disease are all caused by bacterial infections, so it's just about keeping your teeth clean. The best ways are to brush, floss, use a water pick, and for the mini dental implants, there are even special devices for the water pick to squirt everything out, so if there's any bacteria under there, it's flushed out.
Yeah, and come in to see you every few months.
Oh, it's very important that you come in every 3 months to get a cleaning, so that we're doing everything to prevent any problems and for it to last you a lifetime.
All right, and you know, if you're watching and you've been with us a whole half hour, you've been learning about the mini dental implant procedure and how revolutionary it is. If you joined us sort of halfway through Innovations in Health, you're saying, well, what is the mini dental implant? We're going to show you now, again, the models that really bring this home. So if you have a lower denture and it's swimming around on the bottom of your gums and it has a life of its own, and I know some of you are out there saying, that's right, that's my denture. Dr. Fine, how do you fix that?
Well, it's amazing. First of all, take a look. The denture does not fall out. That's because it snaps in and snaps out. What's done is we place these mini dental implants, and the same day, you can snap in your denture.
In place, secure, no fear falling out, and you know what else? That goop, we'll call it, is gone. Yeah. No need for that anymore.
That's right. And look how great it looks. Yeah, there's no need for that paste that really doesn't work very often.
So Doc, odds are if you have a lower denture, you probably have an upper denture, but the difference between the mini and a regular upper denture is the sense of taste is going to come back because the palate is exposed. Show us what that's all about.
Well, it's very dramatic in the difference between this and the conventional denture. Conventional denture goes straight across, it's all filled in here, and the taste buds on the roof of our mouth are covered. And some people gag because it's all wide and the acrylic's all down here, but this, we take it over and clean it out here, exposing the taste buds on the roof of our mouth that makes us able to eat and taste all the foods we love.
And look how it snaps in place, everybody. It just is amazing. Look at that. That's an upper denture example.
And look at how beautiful that smile is.
And no matter what your age, ladies and gentlemen, you really need to take a look at the mini dental implant procedure. So now let's talk about an upgrade. This is called the Fix on 6. So it's like a full set of teeth without the plastic and the acrylic. Show us what.
Yes. So this one is something that stays in place, is not removed. We take it out to clean it, but you don't ever have to take it out. So it's just like having your own teeth again. Look at how great this looks.
You saw the Fixed on 6. Now you're going to see a permanent solution with what's called a roundhouse.
Yes, the roundhouse is an even stronger material. This stuff is even stronger than our natural teeth. Because it's so strong, it requires more implants, but it's dramatic. This is cemented in place. We don't even take this out. It's just amazing in what it does. It basically replaces your teeth permanently.
But now, Doc, if you've got molars in the back of your mouth that have fallen out, you're ignoring them, you should not. They're very important teeth. If you've got a partial that needs to be fixed, show us how the mini dental implant works.
Well, the first thing is our molars are key for chewing. If we don't have molars, it tends to break down our other teeth. So here's an example of it, and the replacement of 2 other teeth. So there it is, and here's the crowns that are placed in there. For the bicuspids, it requires 1 individual implant, but for the molars, it requires 2, because again, that's where we're chewing and that's where more of the pressure and biting and eating is. So it's dramatic in how well it works and how easy it is and how comfortable it is, and replacing your teeth easily.
If you have a single tooth that's been knocked out, you know, in the front, you can't smile anymore, look at how the single tooth option works.
Yes, it's amazing. The single tooth option is that we can do it the same day. And here it is. Here's the example of it. And here's the crown that's put on, in most cases, the same day.
And this is a custom-made tooth, isn't it, Dr. Fine? It's not something that comes out of a box and you just place it into the
No,
implant.
It matches the color of your teeth, it matches the shape and everything of the tooth, so it's just like your other teeth.
Yeah. The mini dental implant procedure is going to change your life with Dr. Bruce Fine and his team at Fine Dental Care, a mini dental implant center of America, 600 Valley Road in Wayne, New Jersey. Phone number to call 973-636-1113. In the Whole Foods Plaza, so we all know where that is, near all of those crossroads that we discussed earlier. The website is minidentalimplantswaynenj.com. You are the guy to go to and your team. Thanks for being an innovator in health.
Thank you so much.
Thank you.
You've been wonderful. Thank you.
Thank you, Dr. Bruce Fine, and thank you for watching.